take a nap?
I'm taking a nap here.
Okay, take a nap right there then. Good night.
Good night.
As a new parent, are you tired? Or more accurately, are you tired of being tired? In other words, are you tired of sitting in the dark, the cold, trying your best not to move for fear of startling your little one awake? If your answer is yes to any of the above, then hang on, as we're going to discuss some of the most common causes of those sleepless nights. So, let me start by asking you one more question. How valuable do you think sleep is to both parents and kids? The truth is that kids have three main jobs for their first 6 months of life: to eat, to sleep, and to poo. Now, in particular, sleep is absolutely paramount for the appropriate development of a child. For example, a child under 4 months of age should ideally be getting somewhere between 15 and 18 hours of sleep in a 24-hour period. So as you sit there in the cold and the dark, doing your very best not to breathe too heavily so little one can settle, what are your gut instincts telling you? And I bet you don't need Dr. Google to validate those concerns. You know that something just isn't right with your child. Now, whether Dr. Google called it colic, irritable baby, reflux, silent reflux, or simply cranky kid-itis, the label is fairly irrelevant. And equally, your maternal instincts are confident that your child is not suffering from a lack of low-sec or coloxal in their diet. So, the three most common causes of your irritable gremlin are: number one, dairy, or more specifically, cow's milk protein sensitivity. Now, in many cases, your child's immature digestive system does not handle the proteins in dairy products very well. The child with a cow's milk protein sensitivity commonly presents with dysfunction at both ends of the digestive system, irritability, and as a result, poor sleep and difficulty settling is a common symptom. Number two, tummy pains associated with breastfeeding issues. Now, this can be associated with point number one, especially if mum is having a lot of dairy in her diet, such as milk, cheese, ice cream, and sadly, chocolate. It can also be associated with breastfeeding issues such as the quality of kiddo's suck and attachment and mum's milk supply, both of which are commonly as a result of point three, which is some form of neck pain. Now, irrespective of how kidlet came into the world, i.e. their birth adventure, their little neck is commonly subjected to stresses for which it is simply not well suited or able to handle. As a result, pain behaviours kick in, such as unsoothable irritability, feeding difficulties, and in many cases, poor sleep. So if you can relate to any of the above and are still confident with those instincts suggesting that your child's behaviour is not normal, there is something not quite right with their little system and they are not deficient in medication in their diet, then I encourage you to explore any of the above causes of irritable and poor sleeping kids with an appropriately trained chiropractor. That is, one who has done extra study on kids. And if you would like any further information on how chiropractic may be able to help yourself and or your child, please go to mhcc.com.au and feel free to share this or any other video from Mount Hawthorn Chiropractic with family, friends and loved ones.